So my name is Andrew Bivard and I'm an imaging scientist. Here at the Royal Melbourne I'm leading a study called MOSES, which is a very large cohort study we want to do where we just collect routine of care data from patients who undergo thrombectomy. So thrombectomy is a highly specialised treatment option for stroke now in patients who have a large vessel occlusion, where an interventional radiologist or a specially trained neurologist can use a catheter deployed through the groin, goes up to the brain and just pulls out the clot. Thrombolysis is a drug that's delivered intravenously, so you go through the arm, and then the idea is that it reaches the brain and dissolves a clot, so it activates plasma, which is used to break down clots. So thrombectomy is a relatively new procedure. It's been standard of care since probably 2015 for patients who have stroke, who have a very large vessel occlusion. So these occlusions are covering very large areas of brain, and so these are a strong area of focus for stroke clinicians because these types of strokes lead to the most catastrophic outcomes. So patients often have the most disability or most likely to pass away, unfortunately. With thrombectomy, there's a 4 times increased chance of patients ending up having low-level disability at 90 days, which is really quite fantastic and leading to overall better outcomes. So the goal of MOSES then is to try and refine how we deliver thrombectomy to patients. So identifying those who are most likely to benefit or those who are most likely to be harmed, and trying to then look for alternative therapies for those patients who may be harmed. So through MOSES, we want to be able to accurately predict patient outcome and then feed this information back to clinicians in the acute setting. So that is when a patient reaches hospital, they go through all their assessments or their brain imaging, and then a clinician can sit down and say, what is the patient's outcome with and without various therapies? That's thrombectomy or thrombolysis, or even if they withhold therapy. So MOSES will be a large registry. We're going to be collecting information from hospitals throughout Australia and the world. So we've got collaborators in the UK, we've got in China, Canada, New Zealand, India, and all major thrombectomy centres within Australia have signed up for MOSES as well. So we stand a really good chance of getting high volume of high quality data. It's quite exciting. So here in the MBC, we're ideally positioned to carry out this project. We've got all the skill sets we need, and it's a real melting pot of expertise. We've got imaging analysis labs, we've got the clinicians who feed back critical questions that they're faced with on a daily basis to us. We've got the health economists and statisticians. The challenge with these large studies is it requires a substantial amount of funding. So while we've applied for government grants, the success rate of those is at historical lows, and so every little bit that we can get in the door helps.